Hello, I'm Dr. Hooper. I'm a chiropractor.
Hi, I'm Melody, the massage therapist.
Today we're going to work on an exercise that I teach patients on building core strength. The majority of your core strength comes from your oblique muscles. They are abdominal muscles that go this direction and this direction. This is a fairly easy exercise that I'm going to actually teach Miss Melody right now to help to strengthen her back, because if your abs are strong, if your core is strong, then it's going to take pressure off your back and can give you some relief. Okay, so what I want you to do, Miss Melody, is I want you to sit on your bottom here with your feet bent or your knees bent and your feet planted, okay? From this position, I'm going to have her hunch in kind of a C shape. So this particular exercise, we don't want to be erect, we don't want to be straight, we want to be in a C shape. So go ahead and get yourself in a C shape. Okay, where you're kind of slouch a little bit. There you go. Good, like that. The next step would be to lean back until you feel like your abdominals are catching yourself. Is it all the way back like that, or can you catch further? So right here, this is where she feels like if she doesn't contract her abs, she's going to fall down on the table. From here, we're going to act like, you can either act like you have something in your hands or actually grab something with some weight. So if she had, let's say that this Kleenex box was a 5-pound weight, what you want to do is you just rotate your body, your whole body, so this is her head, her chest, everything rotates from side to side, like that. The whole time she's contracting her abs and they're not loosening. Now, if she's doing this, right, good.
Right.
So this may be, and this sounds like it may be a little bit difficult for her, you want to start low and start to build up. But you want to do 3 sets of abdominals to failure. So if she only can do 6 going back and forth and stop, grabs her legs and go ahead and relax, that's fine. But she needs to do it until she fails. So when you do this exercise, you turn side to side until you can't do any more and you relax. Relaxation between sets is about 15 seconds. Your abdominals do not need very much time to relax, and you want to keep them contracted the whole time. So, again, planting the feet down. The feet don't float on this particular exercise. Knees bent. She leans back until she's catching herself in a C shape, and she's rotating, like that, side to side, the whole time that she's squeezing her abs. If you feel back pain in this particular exercise, it may be too early to be able to do this exercise, or you're not coming into a C shape tight enough. So you want to get down like you're really squeezing those abs and then turn from side to side like this. You should only feel it in your abdominals. You shouldn't feel it in your back at all. The other thing is, you want to make sure that you're on something padded for your tailbone. So if you are on the floor, sometimes this will hurt your tailbone. You have to be careful.
Put a pillow under you.
Pillow, and it doesn't take much, just enough to cover your tailbone. So it can be just a small pillow. It can be a yoga mat that's folded several times to kind of take the pressure off too. But you want to do 3 sets to failure. So rest, 15 seconds. Go right back into it. Rest for 15 seconds, and one more, and then rest for 15 seconds, and that's all you're doing.
How often?
I generally tell my patients to do about 3 times a week. You don't want to do too much abdominals because you actually can build a lot of muscle, and it actually makes you kind of look fat unless you have no body fat, which there's not a lot of us that don't have any body fat. So you want to do 3 times a week. Your muscles recover very quickly with your abdominals, and this is going to help strengthen her back so that her back muscles don't have to contract all the time. Okay, thank you everybody for watching this video.
Bye-bye.
Bye-bye.